Hi everyone, this is DrDev. I'm a Chief Medical Oncologist at Medicover Cancer Institute, Vizag. Today we will discuss about endometrial carcinoma, which is third most common gynecological malignancy. So endometrial carcinomas usually happens in the elderly females beyond 50 years of age, and it is most of the time present in a very early stage. So coming to the hospital, recognizing the various factors, clinical features, presentation, and coming to the hospital at an early stage can lead to increased survival. So let us go through briefly what are the risk factors, what are the prevention strategies, what are the clinical features, and what are the treatment options available. So starting with the risk factors, the most important risk factor for endometrial carcinoma is excess estrogen exposure. For example, if somebody is taking estrogen only hormone replacement therapy, or if somebody has PCOD, so when somebody has attained early menarche or attained late menopause, so in these women there is an increased estrogen production in the body, which acts on the endometrium, so can lead to endometrial carcinoma development. The second most common is the metabolic parameters. For example, obesity and also diabetes, hypertension, higher socioeconomic status, all these are related to the development of endometrial carcinoma. And the third option is like treatment related, which is because of if somebody has received radiotherapy to the pelvis, or if somebody is on tamoxifen tablet, so they also can develop endometrial carcinoma. Never to forget, there is also familial predisposition. Almost 5 to 10% of the endometrial cancer patients have a family history of endometrial cancer because of Lynch syndrome or Cowden syndrome. So these are the various causes of endometrial carcinoma. So now, how to prevent endometrial carcinoma? We know the causes. If you can avoid obesity, if you can avoid being physically inactive, if you can change lifestyle, so that if you can modify your lifestyle in a healthy lifestyle, we can prevent 60% of endometrial carcinomas. That is, 3 in 5 endometrial carcinomas can be prevented just by changing the lifestyle, just by maintaining your body, that is by reducing your weight. So this is preventable, and so I think it's not beyond our scope. It's always better to prevent rather than treat. Now moving on to unfortunately, if somebody develops endometrial carcinoma, then what are the signs and symptoms? How do they present? The most common presentation would be abnormal uterine bleeding. That means if they can have a postmenopausal bleeding, or they can have abnormal uterine bleeding, then immediately you have to visit your doctor. What we do is that we do a ultrasound, a transvaginal ultrasound. You look at the thickness of the endometrium. If the thickness of the endometrium is more than certain amount, like 4 mm or 5 mm, we'll do biopsy from the endometrium. Thereby, we either refute it or we confirm the diagnosis of endometrial carcinoma. So once we diagnose the diagnosis of endometrial carcinoma, the first treatment choice would be going ahead with the surgery. Surgery is that we remove the uterus, along with the uterus, cervix, and also glands surrounding that is lymph nodes surrounding these structures. Thereafter, depending upon the stage of the disease, depending upon the histopathological features, whether it is what type of histology it is, and what kind of the LVSI, whether it is present or not, we decide the adjuvant therapy. Adjuvant therapy is the treatment which we give after surgery. So adjuvant therapy could be radiation therapy or chemotherapy. So this is the treatment in case of localized endometrial carcinoma. If somebody presents in a very advanced stage, maybe stage 4, then we have other treatment options like targeted therapy, immunotherapy, or chemotherapy, which depending upon the markers, we decide the treatment options. So to summarize, endometrial carcinoma, majority of them present in a very early stage, and if we treat them appropriately, if we treat them correctly, almost 95% of them can have a very good survival rates. I mean, almost close to cure rates. So it's very important to prevent first if possible. If not possible, then to diagnose it in a very early stage. So if you have any doubts regarding endometrial carcinoma, please visit Medicover Hospital so that we can discuss what is your risk of developing endometrial carcinoma, what are the intervention or what are the precautions you can take. Thank you all for patient listening.